Hi, I'm Dan Kendall. I'm the host of the Digital Health Today program and the founder of the Health Podcast Network. I'm here at the Barcelona Health Hub for the Open Doors event, and with me is Sam Odriozola. Sam, thanks very much for joining me.
Thank you for the invitation. It's a pleasure.
Sam, you're the founder of PhiMed Europe, and you also are responsible for marketing and strategy
Correct.
for the organization. So can you start off, first of all, by telling us what PhiMed does?
So PhiMed is a medical technology company, and we are focused on diabetic field and provide solutions for the healthcare system in order to prevent further complications, like, for example, in diabetic foot, to prevent the amputation by providing a technology, making an early diagnosed.
Diabetes is a huge problem all around the world. It's affecting all sorts of populations, age groups, type 1 and type 2. It's having a massive cost on human lives, but also to health systems and communities. So can you explain a little bit about the actual solution that you're delivering and the problem that you're working to solve?
Yeah, of course. As you have mentioned, there is diabetes type 1 and diabetes type 2. And we are more focused on diabetes type 2, which is the huge amount of population. Mostly of them are diabetic. What we are doing is providing a solution for a specific complication, which is called diabetic foot. So diabetic patients are suffering for a lesion of the nerve fibres. So when you can diagnose this alteration in an early stage, you are allowed to prevent, stop, or just slow a little bit this progression that will lead to an amputation of final. And this represents a huge benefit for the healthcare system and also for the population, the patient who is suffering from diabetic.
So the diabetic foot, basically it starts because they've got some nerve damage already. The patient with diabetes has some loss of sensation, so they might not be able to feel some of the beginning of some of these injuries. Is that happening?
Yeah, more or less. Well, first of all, I am not endocrinologist, so to bring a scientific explanation. But what I can share with you is when diabetic people has imbalance, the control of the sugar on their blood, then it leads to damage on those nerve fibers, which are providing you with a sensation of, for example, cold, warm, vibration, the stability. So this is the damage that diabetic patients are suffering from when they have this imbalance level of sugar in blood.
And if they don't detect the injury, the problem soon enough, then it can lead to amputations. And approximately how many amputations are there that are happening around Western Europe or around the world? Do you have any figures for that?
This is published. So it's possible to find in World Health Organization. And there is an amount of one amputation every 20 seconds around the world.
One amputation every 20 seconds. And then, of course, it's not just the cost of that actual intervention. There's lots of cost leading up to that procedure. There's been obviously some care and some impact to the person's life, even in advance of that amputation taking place. And then obviously, with the loss of a limb, a longer term impact on a variety of areas.
Yeah, so you have a direct cost and indirect cost that can be reduced by implementing a technology there. And also the most important is when you are focused on patients, you are enhancing the quality of life because they are not going to lose a limb.
And how does your solution actually work? What is the technology? What does it do?
Well, for us, it's a fantastic solution. And nowadays, we can say that we are by ourselves there in the market. So the solution is the technology and innovative technology already patented, which is performing 4 different tests. And we are testing the first nerve fibers which used to be altered when there is a balance. So we are going to perform vibration test, cold test, warm test, and heat pain test in less than 10 minutes. And the most incredible is that finally we have reached the fact that whether the physician, the auxiliary, the nurse, everyone can be performing a test. There is no need that a specific professional is working with it. So we can place the device in the healthcare, in different healthcare levels. And also the results are going to be the same one. We are standardizing a process.
You have clients already in the US and in some other parts of the world. Can you give us some idea of what the cost of the system is and how it works? Where does the treatment actually have to be, where does the test actually have to be performed?
Nowadays, we have clients a little bit international. So we can say that we have clients in Japan, we have clients in Singapore, also in UK, in Germany, and United States. It's a little bit spread. So they are using, for example, for our research, but they are using it also in the clinical practice. So this is an excellent, because for us, we are getting their feedback. So then we are continuously improving the technology. Nowadays, we are working with the 4th version of it.
So would that be done during a clinic visit? So a 3-month or a 6-month visit, they would actually do this as a part of a routine examination?
Exactly. So our aim is to be performing those tests. For example, when you go to a cardiologist and you get an electrocardiogram, right? So if you go to an endocrinology or neurologist and you have diabetes, so straight away they need to perform this in the beginning, and then you are going to be doing the follow-up of the patients.
Brilliant. So what does the year ahead hold for you? It's 2020. What are some of the things that we should look for in the next 12 months?
Well, I think 2020 is going to be an excellent year for us, because during the last year we have been working to improve the technology, to bring a new product, what we expect to have this year in 2020. But also we have been working in the market of Japan. So we expect that half a year we are already placed in doing the marketing campaign in Japan. So I think it's going to be a fantastic year for us.
Well, the company, again, is called PhiMed Europe. And where can people go to find more information about PhiMed?
Well, if you are interested to find us, you can find us in LinkedIn, in PhiMed Europe, or also in Twitter at MyNerveCheck. And also we are in Facebook, like MyNerveCheck.
And the company is spelled PhiMed.
Correct.
Right?
Europe, yeah.
Excellent. Very good.
Excellent.
Well, thank you very much for coming by the studio and spending time with us and sharing what you're doing. You're solving a really important problem, and I wish you a lot of success, because it's going to affect millions of people around the world. So they need better solutions, and I'm glad you're out there leading the charge.
Thank you so much for the invitation.
Thank you, Sam.
Thank you so much.